regarding Connecticut Department of Veterans Affairs programs and services. We just want to let you know that we are recording this, so be sure that you don't share personal information or identifiable information, because these sessions are not confidential. If you can type questions into the chat portion, the chat box, that would be terrific. If you don't have that capability, if you could raise your hand, we'll try to get to you. And of course, everybody's email addresses will always be available to you for questions if for some reason we aren't able to get to you. Okay, let's go.
All right, excellent. Okay, so it's the Connecticut Department of Veterans Affairs Stand Down 2020. What a beautiful side of our campus here. And it's really beautiful during this time of year with the foliage and stuff. So very beautiful place. Okay. All right. Just gonna go over really quickly the history of DVA here. We have been around. We are the oldest veterans home in the nation, serving those that have served. The first place was opened up in Darien, Connecticut, back in July 4th of 1964, where they received Civil War veterans and the children of veterans, per se. So we do have a very interesting history, per se, as we have been doing the work that we have been doing for over 140 plus years, per se. The DVA falls under the statutory authority of 27-102. I'll let you review that on your own, but basically looking to serve our veterans here in the state of Connecticut. Looking at the definition of the armed forces is U.S. Army, Navy, Marine Corps, Coast Guard, Air Force, and any reserve component hereof, as we have many of our guardsmen as well as our reservists here in the state of Connecticut that have been deployed, multiple deployments since 9/11, and also fall into this criteria of serving them as well. Veteran means any person honorably discharged from or released under honorable conditions from the armed forces. I know as we receive applications here in both facilities, obviously there's the document that is very key in determining meeting this criteria eligibility is a DD-214. Service in the time of war means any service of 90 days or more cumulative days, except if a period of war lasted less than 90 days. Obviously, this falls within the criteria of reviewing that DD-214 and making sure that the veterans that we serve meets those eligibility requirements. For veteran residents, is actually the residential facility here. They receive services in my domain, at my facility per se, and of course the healthcare center is the hospital, or more is a skilled nursing facility that's here also on campus. I'll go to my piece. We work very closely with the federal VA as we follow strict guidelines and compliance with VA requirements. We co-manage the care of our veteran residents as well as our patients here in working in conjunction with the federal VA, being able to follow specific MOUs and looking at the coordinating of costs and managing the cost of caring for our residents as well as our patients, looking at various programmings and constructions that are done, that is all working closely between the state and the federal government. A lot of ongoing outreach and coordination of support when it comes to programming, benefits, and services. And this is something that we do very well here, and especially with the leaders that are at the federal VA here in the state of Connecticut. And I'll go over now the residential program and services. This is me. All right, my facility, we have an admission date, but per se we do not have a discharge date. We do provide emphasis on providing services, transitional housing that provides veterans with continuum of wraparound services, focusing on rehabilitative services designed to return them successfully to independent living. We have had residents here that have been here for quite a while, but we continue to emphasize in working with their priority needs and encouraging them to be able to transition back into the community. And try to do this in the most timely, efficient way. Obviously, depending on what those needs are for each veteran resident, it might take a little bit longer to be able to achieve that goal. And some, to be very transparent, end up being here a little bit longer than they initially might anticipate it to be. But we do have a very good success rate in transitioning our residents out as well. Resident staff assist veterans in developing individualized rehabilitative plan, aligning his or her goals and objectives and removing barriers to achieve them. This could be if they come in for financial reasons, looking at what they're eligible for, what their entitlements are, and applying for some of those benefits while they're here. That includes, service-connected, VA, non-service connected compensation, Social Security benefits, and the sort that we assist them in that whole process. And being able to do that with specifically with the social worker staff that we have here on site. We also, besides the residential facility that I oversee and manage, I also have the Patriots Landing, which is our houses that we refer to as across the street on West Street, as you can see here in the picture. 5 beautiful homes that are fully furnished, and we currently have them, they're full, which is it's a good thing, with the intent that families come in and being able to transition them out within 2 years. So it's a 24-month cap. We do provide on a case-by-case exceptions to extend that time, but it is the expectation that they work very closely with our partner agency, Chrysalis agency, to case manage them and transition them out into the community, into permanent housing as quickly as possible. We have 8 wings in our facility. Most of the rooms is a communal living, as you can see here by the wings that we have. On the average, we have 2 to 4 veterans per room. Currently, we have C and B in the past year or so that were transitioned to semi-private rooms, meaning there's only 2 residents in each of these wings per room. They were completely redone, meaning that they have been refurbished and divided to allow for a much more private living space for these residents. They're actually quite nice. E-wing is our secure wing for females. We have the capacity to have up to 16 females in that particular wing. All beds and rooms have obviously the appropriate furnishings for them. The program fee that we currently follow is a 30% of each resident's monthly income per se, and this gets reviewed often. Obviously, entitlements and benefits as well as income does change, and this is something that we follow closely. We even have residents that have no income, and that means that they don't pay anything to be here. A great benefit here also, as I wanted to highlight, is when a resident comes in, they don't not pay any program fee for 4 months. And I actually do have veterans that come to us and say, you know what, I'm going to save my money and during these 4 months, and I'm going to move out and I'm going to get my place, and we support them with them, and they actually do succeed in accomplishing that goal. The Patriots Landing, these are, like I said, homes that are temporary for families, fully furnished, and they are very well maintained. For them, they only pay $200 a month, and everything is included. Pretty good deal. And like I mentioned earlier, Chrysalis centers are the one that case manage and assist us with meeting the needs of the families. Chrysalis Center, they meet with families weekly and create a case plan or care plan with them and looking at those priority needs. Let it be financing, let it be mental health issues, and whatever it is that they may need, that they focus on addressing those issues, of it. Let it be even health issues or applying them for benefits and entitlements as well, which is key. Additional program and services that we have here in residential facilities, the vocational rehabilitative program, education services. I currently have residents that attend such as Capital Community College, Central, Connecticut State University. We assist them with the enrollment process and the ongoing support that they need to be able to accomplish those specific goals. Employment searches, we do have a partnership with the Department of Labor, but we assist with transportation as needed, but it's this ongoing, once again, level of encouragement that we provide to our residents, depending on what their specific needs are, in getting them to back on their feet. If it is employment, then we assist them with that. If it is some type of specific job training, we get them connected with that as well. If it is they want to achieve, get a degree, let it be a community college or a 4th degree, we'll assist them with that as well. And the key thing here is to see what they're entitled to do. Entitled the benefits to get them connected with that. I just want to highlight on here also with the VA that the vocational program that the VA has, we work also in conjunction with them to make sure that our resident veterans are appropriately enrolled and are if they're eligible to be able to get that benefit also. Because a lot of it's I don't know what I don't know, and providing the educational piece of what they're entitled to as well. The person here that does that is Chuck Leon, which is extremely instrumental and part of our team in helping us with that process. We have our social work and case management staff. They do pretty much everything just when it comes to ongoing meeting those needs, let it be application of entitlements and service, let it be dealing with some mental health service, referring for services related to some specific needs a resident may have, taking them to court when they have legal matters that are pending, applying for conservatorship of a state, because here a person can be conservators of state and helping them with finances, but not a person. You name it, they deal with it and manage it here on a daily basis. We also have the Department of Mental Health and Addictive Services that we have a partnership of providing on-site programming in addressing substance abuse, so substance use issues such as drug use or alcohol use. But we also collaborate with once again our VA partners or other community agencies to kind of provide that once again the wraparound services for our resident veterans to help them get on track and get on their feet, and also assessing the level of care or treatment that their resident may need depending on what's happening for them. Let it be outpatient, let it be an IOP, or recommending them for higher level care, let it be an inpatient stay or even a longer term program that they might need per se. And we will work with that, and sometimes even having to send them out of state, but we'll do that in collaboration with our key partners, all in the best interest of meeting those priority needs of our veteran residents per se. Collaborative partnerships work very close to the Department of Labor, and once again, making sure that they are enrolled with Connecticut Hires, getting them enrolled with that process, and really assessing, where is our veteran resident now? When is the last time that they worked? What are their skill sets? What is the work experience? And where is it that they're at this stage of their life? What is it they want to do? Do they want to go back and do what they did in the past? Or do they want to do something differently, get retrained, learn some new skill sets, and work with them to get them back into the workforce as soon as possible. We have Connecticut Veterans Legal Center partnership as well. We have quite a few of our residents that end up being homeless, and some of them related to financial hardships that they might have, poor credit. How do we work with them in improving their credit? How do we address issues of eviction processes, and other legal matters that might be barriers to achieving permanent housing or securing long-term housing, as well as sometimes even getting in the way of being able to get employment. So looking at all those matters, and they're very instrumental in supporting our veterans here as well. We also work closely with the Department of Social Services. Once again, this week falls into the area of eligibility when it comes to health, medical coverage services such as the HISCI program, ensuring that our residents are enrolled and that what are they eligible for, that they apply for, like that coverage for whatever specific services that they might need, that we have that in place accordingly. We also have a partnership with Eastern Seals, the Veterans Rally Point, and they also assist with housing and employment services. Recovery support services, this is the Department of Mental Health and Addictive Services. We do have a rehabilitative counselor here on site that works with our residents, and they do from groups, individual sessions, and just ongoing, if it's need be, testing or screening, we would do that also. Recreational activities, keeping our residents is very important, and looking how they keep their days occupied. And we do this through various recreation and activities. We have a Vet Connect computer center that is available and accessible by our residents 24 hours a day. Has a little bit for the use of job search, or let it be for entertainment, that it's available. We have the fitness center on campus and community-based recreational activities. We have a lot of avid bowlers here. And obviously with the whole COVID-19, we've had to get very creative in providing this continued support, and we've been able to do that. Obviously, as the communities are opening up a little bit, we've been able to expand and open up and getting our residents back out and engage into recreational activities back in the community. Transportation services to work, education, medical, or personal needs between, we have buses that come here, we have taxi services as well, and sometimes we do get donations such as for Uber services, we use that as well. Transportation key to get our residents to the medical appointments to Newington and to the West Haven VA. which is key, as well as to other medical appointments such as a UConn that's our partner in providing the dental support for our residents. I know that's a lot that I've thrown out there, but we stay quite busy. Currently, we do have 120 residents that are here in our facility, and obviously we're open. One thing I must say we pride ourselves is that we've been very flexible, knowing that the need is still great out there for our veterans, and getting creative on how we continue to admit veterans here. And there's an admission process that we go through, and there's testing is required for COVID-19 screening as well. But the application is on our website. Service providers as well as veterans can go there and download that application. But obviously being able to call us here directly to request that application, we can mail it to the veterans or whoever might be working with a veteran to complete that application and work directly with them. But we're here, we're available, and doors are open to continue to serve those who have served. So Laura, I'll turn it over to you.
Thank you, Leslie. Good morning, everybody. Welcome to Stand Down 2020. My name is Laura Nelson, and I am the administrator at the John L. Levitow Healthcare Center here on the campus, our beautiful 92-acre campus. It looks, at this time of year, it just reminds me of a beautiful Vermont-looking sort of college campus, if you can picture that, with lovely buildings and a view that is really spectacular. The facility is sort of perched up on a hill, so it's positioned so that most of the windows that you look out have this beautiful view of the Glastonbury Hills. And at this time of year, I think it's the most beautiful from now into October. So thank you for joining us today. I'm happy to answer any of the questions that you may have. As Leslie mentioned, we are a skilled nursing facility. And just a quick history, we were licensed as a chronic disease hospital up until March of this year. And we are now licensed as a skilled nursing facility by the state of Connecticut. And we're certified by the federal branch, CMS, which is the Center for Medicare and Medicaid Services, also as a SNF. And what that means is there are certain aspects of Medicare A that we can recognize here as a payer source that will cover part of your stay, and that we also recognize Medicaid. So if you have long-term care Medicaid and you're approved for a skilled nursing facility, that would be your payer source in our center. In addition to that, we are co-managed, as Leslie said, with the federal VA. We co-manage our veterans health care, and they also certify us as a state veteran home. So we have lots of people looking over us and assisting us in caring for our veterans. We offer long-term care, and we also offer short-term rehabilitation. And then sort of, I don't want to say by default, but sort of as the natural progression may take place, we offer palliative care, which is more comfort care. People have a chronic disease and they don't want to seek any aggressive treatment. We care for people that have made that choice, and that's becoming a more common choice. And we also care for people at the end of their life. And some people who are at the end of life have been with us for a very, very long time and have just grown old with us, and others come because they can no longer be cared for, typically by family, and they come to us for their end of life care. And I'd like to share with you that I think our staff, many of whom have been here for a considerable amount of time, are very, very well-trained professionals. And that's sort of the heartbeat of the building. And that's the feeling that you get when you come here, is a very warm feeling. And we know our veterans well. We care for people with all different types of diagnoses. There are very few that we cannot care for. And what I often do is, everybody has a story. So what I say is, if you want to just share your story and you want to explore what we can do for you if you do need skilled nursing, we have an admissions department. And I'll share their phone number with you. It's 860-616-3708. And Linda is in charge of our admissions here, but she also has the backup of our fiscal staff, our clinical staff, and our medical director. So she spearheads the information, but everything is reviewed by a multidisciplinary team. Does anybody have any questions so far? Okay, hearing none, I felt compelled as a healthcare administrator to share with the audience that throughout the pandemic, which of course we're still in, we never shut our doors. We've never been closed. Our staff has been here, and we can't telecommute. You can't provide care from a remote location. So we've grown very close as a team. And I think that our team is doing an expert job at caring for people during this very difficult time. And in conjunction with the federal VA, we have very rigorous testing that we do. And we have not had a positive COVID-19 case in our facility since May 5th. We have had 5 total cases in our facility. They were identified early on and cohorted appropriately. And we've had about 10 inspections by the Department of Public Health, which we have not received deficiencies on. And I think it's important to share that information. We're very hand in hand with DPH. They are the overseers for state skilled nursing facilities. And we are very proud of the work that we're doing here. We do screen the staff every single week, and we screen the veterans at this point because we haven't had any positive for so long. We're only screening the veterans if there's a reason to, so perhaps a fever of unknown origin or something along those lines clinically. Want to go to the next slide, Leslie?
Sure.
Thank you.
Let me see. Just let me go to the next slide here.
That's okay.
There you go. There it is. We're there, Laura.
Okay. I don't see it on, oh, there it is. Okay. So our building is actually the newest skilled nursing facility in Connecticut, both in physical plant, because we were built in 2008, and by licensure. So we're the new kid on the block. I think we have one of the nicest skilled nursing facilities that I've ever been in. I'm not biased, of course. I've been in many, and ours is really beautiful. We have a mix of private rooms and semi-private rooms, all which have their own bathroom and are quite roomy compared to other skilled nursing facilities. We have smart TVs for every veteran. We have a fully engaged electronic medical record, which speaks to our pharmacy. Our pharmacy is also on site. And we have an automated medication pill distribution system. That's pill distribution that goes to the clinical team, and then the clinical team physically distributes the medication to each veteran. We have a therapy gym here that's fully equipped, both with talented staff and therapy equipment. We have a lovely library and computer room with Wi-Fi throughout the facility. One of the nice programs that we offer here as a veteran-centric facility is the Quilts of Valor. The Armed Force birthday celebrations. We have shadow boxes displaying career and family items for each veteran outside their room. It's makes it very personal sometimes in an institution, you want to take that extra step and make things personal, and that's what we do with the shadow boxes. And people are encouraged to decorate their rooms as well. We also have recreational activities, which are smaller in nature at this point because of COVID-19. And before the pandemic, we also had a very robust volunteer staff, which we are allowing back sort of in small increments. And at this time, there aren't any coming into the building, but we are looking at revisiting that policy in the near future based on our non-COVID positive status at this time. Any questions from the audience at this time?
There aren't any in the chat, the meeting chat.
Okay.
So,
Okay.
All right. Next slide.
Okay.
oh, actually, we do have one.
Mm-hmm.
This is the question is, are all VA doctors at your facility federal or state employees, or a combination of the two? And that's from Christopher Pollen.
Okay, thank you, Mr. Pollen, for asking that question. And our physicians that are inside our building, we do have two from the federal VA. One is board certified in internal medicine, and the other is a board certified psychiatrist. And we have 4 other physicians that are actually state employees that we contract through the Yukon Health Center in Farmington. So we have a hybrid approach, and that's just for the MDs who are inside the building. Our veteran patients have access to anybody that they wish to go to, and they go to many different acute care facilities throughout the state of Connecticut, including both the West Haven and Newington VAs, but they also go to Hartford Hospital and other hospitals. But the doctors inside the building are a hybrid of federal and state. You're welcome. Some of the clinical programs that we have, I've touched on a bit already. The palliative and end of life, I've already touched on. We do have a memory care unit as well that does have specially trained personnel, all of whom go through a certified dementia training program. It's quiet at this time. Our patients are well managed on that unit. And for any of you who have experience caring for people with dementia, you know how tricky it is. Our respite care program is on hold at the present time. We are again looking at opening that back up as well, but have not made the decision to do so as of yet. And that program is very specifically designed through the federal VA, and it allows caregivers at home who are caring for veterans to have a break from the care that they're providing, which is so important as a caregiver. And that veteran would come to us for about a month, allowing a rest for the caregiver. And again, like I said, right now it is on hold, but we are re-examining our ability to open that back up. So we're also music and memory certified. And what that means is it's a specialized program where veterans have playlists that are unique to their likes, and they have a headphone set. And sometimes as people are looking for things to do, or even sometimes when people feel a little bit down or perhaps agitated or isolated, which of course we are seeing a little bit more of, that playlist and the headphones are offered to the veteran as a way to feel better, actually. I'll call it what it is. And music, we know that music can make a very big difference in the life of a person, and especially those who are in skilled nursing right now, who are feeling a bit isolated. So we've looked at special ways to help lift their spirits, if you will. What I would like to say to anybody that needs more information about skilled nursing is we are more than happy to speak with you again, about your special circumstances or special needs.
You're able to do something, right now, right now, you feel like
I don't,
but this still drops off right in front of you.
That's great, because I have to go do other stuff.
Somebody might need to mute themselves. I'm sorry, I thought I would have that ability to do, but if you've got somebody's unmuted, please mute yourself.
Chris, you can do that.
there we go. At this point, I'd like to entertain any questions that people have for the healthcare center. I want to say one more thing that's very nice about veterans that come to our campus is we have recently had people admitted from Lesbia's residential facility. Their care needs have increased, and it's very nice for our veterans to then be able to come up to the healthcare center. It's a nice sort of, I don't want to call it seamless. I don't think the veterans would agree that it's seamless, but it's very built in for them. And it's nice to be able to care for people from the time that they're fully independent in Leslie's shop until the time that they need that additional care. And sometimes they don't want to make that change, but what is so gratifying is that once they make the change and they're getting the care that they need, they really do thrive. And we've seen it recently, and it's been really rewarding to know that our agency as a whole can care for that person for such a long period of time and do such a nice job with it. So at this point, I'll take questions.
That's for both of us. If anyone has any questions for the residential facility as well, it's really a partnership and collaboration. I know there's a lot of efforts and outreach that we are continuously making, ensuring that our information is out there in the communities, let it be in rehab facilities, let it be at our homeless shelters, and really letting people know that we're here. We're here, we're open for business and willing to accept and work with our veterans. And like Laura nicely indicated, that our residents might come here to my level of care and things change for them. And once they change and they need higher level of care, then we do that, and we work that collaboratively. And we don't do it alone, because it is a team effort in ensuring that they receive the care that they need. Once again, that key buzzword, that wraparound services for providing a good quality of life for our veterans. And some of them, yes, they are stubborn and not wanting to and resist, but we provide a lot of encouragement and in the most dignified, respectful way of getting what they deserve and meeting those needs, per se. So questions folks may have.
Yes, there is another there. This is a great question. Is there any situation when a veteran might not be eligible for health care? And I'd like to add in too, if you could talk a little more about if this is if this admission to the skilled nursing facility is free. That's a question I get a lot from folks.
Okay. It's sort of a loaded answer, and I'll try to answer it as concisely and simply as I can. There are multiple types of payer sources in a skilled nursing facility. Medicaid is typically nationally pays for 70% of nursing home patients. In state VAs, at least in Connecticut, if you're 70% or more service-connected disabled, that typically, not always, but typically will cover a skilled nursing facility stay. The other types of payer source are, again, Medicaid, which is also referred to as Title 19, or Medicare, also referred to as Title 18. Some private insurances cover nursing homes, although our facility does not take private insurance at this time. And some people do pay out of pocket, or what we call private pay. So people have different payer sources inside the same building, depending on what they have qualified for. Does that answer the question?
Thank you. Yes, mine. And then there was, Christopher also asked if there was a situation where someone would not be eligible for VA healthcare.
So VA healthcare covers a large range of services. Veterans, if they've been honorably discharged, and even in Connecticut, our commissioner had legislation change so that even under certain cases other than honorably discharged veterans could get VA services. But VA healthcare is federal and separate and distinct from a state certified veterans skilled nursing facility. Those are two different healthcare arenas. So not all veterans are going to get skilled nursing facility coverage under the federal VA, if that makes sense. It's complicated. But again, I just want to put that offer out. If you want more information that's more specific to your background and your what you're qualified to receive in benefits, our admissions staff is happy to assist you. Everybody is a little bit different. It's not a cookie cutter.
I just wanted to add to that, to Laura's response, that one of the things that I know I do with my residents here is providing that ongoing education and asking them the question, do you know which priority group you belong to at the VA? And many a times I get the deer in the headlights look. I have no idea what you're talking about, Leslie. I said, okay, so let's find out which priority group you belong to, because that really is what gears what you're going to be eligible for by the federal VA. And also that changes, and sometimes it changes frequently per se. So it's really an ongoing educational process that I know us here, actually both of us here, have to engage our residents as well as with the family. So it's not just working with a veteran, but it's also educating the family as well. That just because you have a VA card, does that mean that you are entitled for everything? That's not the case. And I know that's could be very frustrating for some of our veterans as well as our families. So I get the calls, Laura gets the call, so we have to, and I know, Ann, you're the moderator, but I'm sure you get these calls as well, and it becomes an educational process that we have to go through as well. So that's a very good question. Great. Any other questions? I know we still have a few more minutes, but if we don't have any additional questions at this point. Okay, well, unless anyone else would like to add or has any questions, we're going to conclude our presentation at this point in time. Thank you so much for joining us this morning. My number here, if anyone wishes to give me a call, is 860-616-3801. My admissions coordinator is Carol Gretorix. And of course, our information can be found in our website. That's Connecticut CTDVA. You can visit the website and all information is there. We're here, we're available, and the doors are open. Thank you very much for your time, and hopefully be able to enjoy the rest of information such as throughout the day today, and being part of this new way of doing Stand Down 2020 in the DVA. Thank you. Have a great day. Take care.
Thank you.
Thank you, Ann.
Thank you both. That was excellent. And I am going to end the recording now.
Okay.
All right.
Thank you. Thank you.
All right, guys.
Thank you, Chris. Thank you so
you.
much.
No problemo.